Hi, everybody. Today's focus is going to be on some of the main blood vessels associated with both the heart and the rest of the body. So we are going to start looking at some of the main blood vessels associated with the heart. So here, associated with your left ventricle, if you guys recall your heart anatomy, would be right here. So the main blood vessel that comes off of it is your aorta. Now, if you're looking at the direction of the blood moves up first, making this portion the ascending aorta, and then it curves to make the aortic arch, and then it slightly comes back down to go and basically supply the lower limbs of the abdominal cavity. And that portion, because the blood is transferring downward, is referred to as the descending aorta. You also have the main blood vessels associated with your lungs. So again, if you take the right ventricle here, and the main blood vessel that's coming off of it is one big branch called the pulmonary trunk. And pulmonary trunk is going to branch to the pulmonary artery. So you see one of the pulmonary arteries right here and the other one right here. So if you want to be specific, this would be your right pulmonary artery, and this is your left pulmonary artery. Now, again, recall from your respiratory lab that when the blood ends in your lungs, it goes from deoxygenated blood to oxygenated blood through the process of gas exchange. So you will have pulmonary veins returning blood back toward the heart. So this chamber is the one that's going to receive oxygenated blood, which is your left atrium. And you have these two blood vessels right here. Those are your pulmonary veins right here. And this one are also your pulmonary veins. So looking at some of the main branches of aorta, so there's three main branches that come off of your aortic arch that are responsible for supplying your arms, your neck, and your head. So starting from the beginning of the arch, so closest to the ascending aorta, you have the first branch, which is as a whole called the brachiocephalic artery. Now, if brachiocephalic goes up, it forms one branch that goes up the neck and toward the head, and that's called the right common carotid artery. And the second branch comes over the arm, over the shoulder, and comes over the arm. And at that point, when it branches off of the brachiocephalic, it's called right subclavian artery. Because again, this is the region you will have your clavicle, so subclavian is associated with the clavicle. The second branch of the aortic arch is the one that associated with the left. It is referred to as the left common carotid artery, which is basically running parallel to the right common carotid artery. And the last branch that you have coming off of the aortic arch is the left subclavian artery, which you see right here, which again is parallel to the right subclavian artery. So if you guys notice, basically the main difference is instead of having the right subclavian and right common carotid artery, these two coming directly off of the aortic arch, they actually first start as a large branch called the brachiocephalic, and then they branch to smaller branches, which are parallel to what we see on the left-hand side. Now, when we have take the blood and we have returned it back to the heart, so this is basically looking at some of your veins. The main vein that is coming into the right atrium of the heart is your superior vena cava up here, and then inferior vena cava down here, even though it's not labeled. Now, where is the superior vena cava collect blood? It collects blood from the right brachiocephalic, which is this really tiny space, and the left brachiocephalic vein, so these two. And then if you're looking at further branching of that, you have the one that is coming from or parallel to the common carotid artery, which is your right jugular vein. And the other branch is your right subclavian vein. So this right subclavian vein, which you see right here, is parallel to the right subclavian artery. Again, you can see them right next to each other. And common carotid artery is parallel to the jugular vein. So again, here is your second jugular vein for the left-hand side. Therefore, this little piece that you see that's not shown as continuous, that's your left subclavian artery. And when this one and this one merge together, you form your left brachiocephalic vein. So the arrow, I apologize, I just noticed this. This arrow left subclavian vein should be up here associated with this piece right here. So it has moved. Now, what are the name of them? Some of the main blood vessels that collect from your face and your head. One that runs over your face, easy to remember, facial vein. And one of the main branches that is collecting or emptying into the jugular vein you see right here is your internal jugular vein. Now, is it as simple as it's depicted here? Of course not. There is a lot more branching happening, especially in terms of your brain, but we're not looking at those branches. We're just keeping it simple right now. So let's track the right subclavian artery. So again, kind of remembering the path of the blood, we're starting from the left ventricle. We're going through the ascending aorta. The first branch becomes brachiocephalic, and brachiocephalic branches to the right subclavian. Now, as right subclavian comes down, it goes under the armpit right here. So it becomes the axillary artery, comes over the arm, becomes the brachial artery, and then form two branches, one on the side of your pinky, which is the ulnar artery, and one on the side of your thumb, which would be the radial artery. As we know, radius runs on the side of the thumb. That's where we can actually measure our pulse as well, called radial pulse, and on the opposite side would be your ulna. The veins that are collecting blood from your arm and your forearm, some of the main one we have is this little branch that is kind of connecting or collecting from multiple veins, is median cubital vein. Cubital means it's associated with your elbow. We have two main veins that are collecting blood from your arm region. And again, these are not all of them, but these are some of the main ones. The more medial one is basilic. The one that is more lateral is cephalic. As you come up, you can see the brachial vein right here. Brachial vein again goes under the armpit, become axillary vein, and auxiliary vein goes right over the shoulder to become the right subclavian vein. Quick note, guys, anything that I'm showing you for right here in terms of the arms or legs as we go through this is going to be identical on either side. The only difference is, as I mentioned earlier, is in terms of arteries and the first branching from the aortic arch. Everything else is identical for both. Again, are these the only vessels that we have collecting blood from the arm? Of course not. You also have the ulnar vein and radial vein, but I am not discussing them in this picture because they're identified as deep. Now, this picture, kind of orienting yourself, this dome-shaped structure you see right here is the diaphragm. This is your liver right here on the right-hand side, a spleen on the farthest left, and then you have your paired kidney organs on either side. This is your inferior vena cava right here, basically collecting blood from all of the organs in the abdominal and lower limbs. And here is your aorta, basically supplying both the abdominal cavity and your lower limbs. So as you pass through the diaphragm and you get into the abdominal cavity, there is one main branch that comes off of the aorta. This is the first branch that comes off of the aorta. Now, this branch comes out of the aorta as one relatively thick, and I put that in quote, called the celiac trunk. Now, as the celiac trunk comes out of the aorta, literally comes out, there are three main branches that come off of it. One that is associated with your stomach, called the left gastric artery. One branch goes to your spleen, called the splenic artery, and one branch goes to your liver, called the common hepatic artery, which is this one right here. It is referred to as common hepatic artery, the word common, because as it goes to your liver, if you guys Remember or recall from looking at some of your pictures, liver has multiple lobes. So this common hepatic artery eventually branches to supply each lobe with their own blood supply. Now, parallel to your splenic artery that's depicted in red, you have the blue one that is going to be emptying into the inferior vena cava, and that's called the splenic vein. Going farther down, you have the blood vessels that are supplying your kidneys. So again, one blue, one red. The red one is the renal artery. The word renal is associated with kidney, basically. And the one that collects blood, one right here, are your renal veins. Now, right below your celiac trunk, which was right here, you have another branch that comes off. This is going to supply the abdominal organs, mostly digestive viscera. And the first one that branches off is the superior mesenteric artery. Then we already talked about the renal artery. And then we have another branch that comes off of it called the inferior mesenteric artery. Now, we already identified superior and inferior vena cava, so we're going to skip those. Now, again, continuing down with the descending aorta. Now, at this point, actually, this is referred to as the abdominal aorta because it's in the abdomen. So, abdominal aorta. Now, abdominal aorta, as it reaches the pelvic area, it must branch to supply both legs or lower limbs. So the immediate branching of the abdominal aorta forms a blood vessel called common iliac artery. So again, here is your pelvic bone or your os coxa as a whole. And remember, the top portion of the os coxa is ilia or ilium bone. So the name of the blood vessel associated with this would be the common iliac artery. Now, common iliac artery is going to form branching. So the branch that is moved more inward toward the center of the pubic region or pelvic region would be the internal iliac artery, and the continuation that's going down would be the external iliac artery. We also have the main branch that runs right in the midsection, which is called the median sacral. And as the name probably implies for you guys, or you guys should make the connection, is going to supply the sacrum with blood supply. Now again, notice the parallel blue color blood vessels are depicting veins with the same name. So you have blood collecting from the external iliac vein, from the internal iliac vein, and when these two merge together, they form the common iliac vein, which they dump into the inferior vena cava up here. Now, what are the supplies of the blood going for your lower limbs? So if right here, if you guys are following the previous slide, this is my external iliac artery. So external iliac artery comes down and runs right by the femur. So these would be referred to as your femoral artery. It goes behind your knee. So notice this is your kneecap right here. So the leg is sideways. So this is behind your kneecap. That area is called the popliteal artery. And again, this is another place that you can actually measure pulse for the leg to see the supply of blood for the limb. So that's again called the popliteal artery right behind it. And then if you continue going down, you become, you're supplying the posterior aspect of the tibia. So this is referred to as the posterior tibial artery. Now, there is a secondary branch coming off of the external iliac from up here. This branch goes deep into the thigh muscles and therefore they call deep femoral artery, even though it's not the best way to depict it. Another one you see, if you look at the leg is facing forward. So this is the anterior view of the leg. Notice again, here is your knee joint, but there is no kneecap. The kneecap has been removed. But again, this is the anterior view versus a medial view of the leg. So the blood vessel that you can see right here, running right next to the tibia, that would be your anterior tibial artery. And again, this one that runs in the back would be the posterior tibial artery. For the vein, the one that runs on the side of the leg, it's referred to as the great saphenous vein. There is no great saphenous artery, so don't look for it. Great saphenous vein comes up toward the femur, forming your femoral vein. And again, you have the deep one, which is your deep femoral vein. And when these merges with other blood vessels, then they empty into what we already identify as external iliac vein. And if you guys recall, going back, if this is my external iliac vein, external merges with internal iliac vein, becomes the common iliac vein, and that eventually empties into your inferior vena cava. We are not going to look at the cat blood vessels for now, so you guys can skip those. Please make sure you guys take a look at your PowerPoint and let me know if you have any questions about this.